Are you having a lot of pain during intimacy and you don't know where to begin to lengthen and strengthen your pelvic floor? Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. In this video, we'll be talking about pain during intimacy, and there's different types. It could be vaginismus, or it could be a different kind of pain. It could be your pelvic pain, or you feel like something hitting you hard when you have penetration. So we're going to learn about our pelvic floor. Why do we have pain during intimacy? If you don't have pain during intimacy, that's great, but some women suffer. So let's talk about why sometimes it happens. First, it could be an injury on your tailbone. So when your tailbone gets injured, guess what? The pelvic floor attaches to the tailbone. Or during pregnancy. If you have pregnancy and there's a downward pressure, then there's a chance you weaken your pelvic floor. And when you have intimacy and you get the clearance from your doctor, you start having pain, deep penetrating pain, no matter what's your position. So when you get hit, you feel like something's hitting you inside, that's a sign of weakness. Third, pain during intimacy when you're in different positions. So the best position is missionary without lifting your head or your shoulders. And that's why it's important when you have intimacy and you're in pain, you should be relaxed and just opening your legs and just making sure you're not holding your breath. It's key to keep everything in a relaxed state. They forget that they think for women, you should be tightening it so it's pleasurable for men, but actually it's not pleasurable for them when it's too tight. It actually should be relaxed and open. It's just a gentle contraction and relaxation of our pelvic floor. So if you have pain during intimacy, this exercise sequence, you will need to learn how to do proper breath work first. Reverse Kegels are important to help lengthen, but at the same time, for those women who just had babies or perimenopausal, menopausal women and they're getting dry in that area, I recommend some hormone replacement therapy or nutrients, which means your food and your diet is rich in nutrients. However, if diet, you did everything and you still feel like you're having atrophy on your vagina, you feel like it's not the same like when you were 25 years old, because of as we get older, we lose muscle. Just imagine, once you turn 30 years old, you lose 1% muscle mass every year. And that's why we need to build strength on your gluteal muscles. I noticed with women with weak glutes because of an injury, you need to really strengthen your glutes. The stronger your glutes, the stronger your pelvic floor. However, the hip adductors are the mirror of your pelvic floor, which means when you can't open, then it gets really tight. You really need to learn how to stretch and lengthen this area. So if you touch this area, the hip adductors, and you feel tightness and pain, that's the mirror. That's what you feel inside as well. So it's important to lengthen and strengthen this area. So in this video, we're gonna do some lovely foam rolling exercises. I have a 6-inch foam roller for absolute beginners and 3-inch foam roller for slowly progressing going down. So let me grab my foam roller. So this is 6 inches and this is 3 inches. So the 6 inches is gravity assisted. This is very soft, great for absolute beginners. You want to make sure your foam roller is not too stiff and hard, or else your pelvis can't handle it. However, if you don't have a choice, you have a hard foam roller, I don't want you to use it. I would rather use a roll towel. But it's not the same when you start moving your exercises. So if you want to get your own foam roller, you can grab one inside my TikTok shop. It's coming soon. I'm just waiting for approval and you'll see my foam roller ready for you to directly purchase. Okay, my friends, we'll begin the exercises now. So as I said, the stronger your glutes, the stronger your pelvic floor. So today we're going to do a lot of glutes activating exercises. Second, we're also going to do hip adductor lengthening and strengthening. So when you make love or intercourse and you're very weak in this area, you are collapsing in your canal. And when you're collapsing in your canal, you feel like when you have sex, you feel like it's a deep penetrating pain. However, if you have patients when they start entering the entrance, you have pain during entrance, then that's the muscles are a little bit more superficial, because there's layers inside our pelvic floor. So in that area, you really have to learn how to stretch this area. I used to have pain during intimacy. I'm sharing to everyone, to each one of you. It's very deep to me to share, but because I'm so passionate on sharing this techniques, because I want to help as much women. When I was suffering at the age of 27, I didn't know what's happening. I see the doctor, no one's telling me it's pelvic floor. They check my ovaries, they check my canals, they check my uterus, and there's no fibroid, there's nothing that's enlargement there. Everything looks so healthy, but I was suffering. I was in pain. Every time I have sex or intimacy, I was bleeding. And I thought, is this normal? Is this still part of life? And it took me a while to understand. That's why I deep dive to pelvic floor health. I deep dive to Pilates and core and yoga and everything you're gonna learn in my channel. You're gonna start embracing it. Even though you don't have pain during intimacy, it could happen in any point of your life. You know why? We get weak. When you get weak, things happen. That's why any part of your body, you want to strengthen your shoulders, your back, your core, but don't forget to strengthen also your pelvic floor, to learn to isolate. So today, when we're gonna lie down, we need gravity assisted. So this 6 inches foam roller that you can check out in my link coming soon in the description below. As you lie down on your back, hips up, you want to make sure gravity assisted. So when you're gravity assisted, for women with pain, it's hard for them to find the pelvic floor. When you're in pain, you lose the connection from your brain to your pelvic floor. So how do we connect? We can connect by imagining not to poop. It's easier for women to find it, not imagining not to pee. Because when you imagine not to pee, you're going to end up squeezing your stomach in. And when you're squeezing your stomach in, you're opening that canal in the wrong way. You're going to cause more spasm. You need to learn how to flick. We call it flicker on our pelvic floor. So which means as you imagine not to poop without holding your breath, without squeezing your stomach, without squeezing your butt, imagine how to hold your poop and let go. Hold your poop and let go. Do 10 quick flicks. That will help relax the pelvic floor. And it's important what you eat and drink. If you have a lot of food and drinks that causes your bladder to spasm, guess what happened to your pelvic floor? It starts spasming. So again, you take a deep breath, you push your belly out. When you push your belly out, you're slowly stretching your pelvic floor like a beautiful hammock or a sling that holds our ovaries, our organs, our reproductive system, our colon. So as you inhale, you push your belly out, and then you flicks. Hold your poop and let go. 1 second quick flicks of holding your poop and 2 seconds of pushing it out, imagining you want to fart. That's reverse Kegels. So you have to learn how to Kegels and reverse. Kegels and reverse. Do that 10 times in the morning to calm the bladder and the pelvic floor. So if you're dehydrated, I notice most of my patients with pain during intimacy, they're usually very dehydrated. They're drinking a lot of drinks that causes diuretics or with caffeine, like coffee. I used to drink 3 to 4 cups of coffee a day when I was suffering, and I would seldom drink water. Instead of water, I'll drink caffeinated tea. So I was always wired up running around as a physical therapist in the clinic. So that's not good for your pelvic floor. So hold your poop, let go. Hold your poop, let go. So that's the first exercise. After you're doing your quick flicks for 10 seconds, 10 times, that's all you do in the morning, lying down with the foam roller, doing this at night, during lunch, and during bedtime. After doing that, now long holds will help strengthen. This will help your problem with your intimacy. This will also help leakage. So if you're leaking, this is your key, okay? So how do you do this? You hold everything for 10 seconds hold, which means holding your poop for 10 seconds hold. And that's very important. So holding your poop without using your core, without using your butt cheeks tight, without using your abdominal muscles. When you hold your poop, you want to make sure you're just isolating that area. So let's begin holding our poop exercise, okay? So lie on your back with the foam roller underneath you, again, gravity assisted. So you're gonna try, hold your poop, hold your poop, hold your poop, hold your poop. I'm counting with my fingers. You can use timer. Hold your poop, 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 and then let go. Once you start doing that, you want to make sure you let go for 10 seconds as well. While letting go for 10 seconds, you're slowly letting go, pretending you want to fart for 10 seconds. Okay? And now hold your poop again. Hold your poop, 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 hold your poop. I know it's a lot of poop because that's easier for women to find. After doing that, 10 seconds hold on, 10 seconds off. Do that for 10 times and then you can do this exercise. So let's begin this lovely exercise. Remember, I told you, the stronger your buttocks, the stronger your pelvic floor. And then the more you can lengthen these hip adductors, that's the mirror of your pelvic floor. So let's begin. As you breathe in through your nose, exhale slowly, zip it up, exhale and tabletop. Inhale down, exhale, switch to the other side. Breathe in, breathe out. We'll do this 10 times. The hip flexors, the prime mover of your hips, are so important to support our pelvic floor. Inhale, I'm pushing my belly out. You can see that, right? So it's gently stretching, and then exhale, lift. Inhale, exhale, switch. 4 more. 3. Feels so good on your hip flexor, especially gravity assisted. Inhale, exhale, switch. 2 more. Last set. Well done. Now let's do single leg raises. So you're gonna extend one leg. This will help stretch the tightness here. This will help your intimacy. You really need to slowly lengthen this with the foam roller. As you breathe in, so you can see my abdominal muscles rising. You want to make sure you're not breathing through your chest, but breathing through your abdominal muscles, diaphragmatic, and it stretches gently your pelvic floor. It's important to stretch it gently. As you breathe in, breathe out, zip it up and lift up with your foot pointing up to the heavens. Exhale with your breathing through your mouth, like blowing through a small straw. And then dorsiflex your ankle to stretch your calf and your hamstrings. As you inhale, you can see my belly rising as I slowly lower my foot down. And once you reach it down, you tip your toes again, and then zip it up and breathe out. Toes pointing to the heavens. Once you reach it all the way up, you dorsiflex, and then exhale down. Inhale down, and then tip your toes and lift. 4 more. Feels so good on your hip flexors. Strengthen and lengthen at the same time. 2 more. Last one. Well done. Now we switch to the other side. Bend the other leg for support on your spine. Keep the other leg straight now. As you breathe in, breathe out, lift. And then dorsiflex, and then slowly breathe in. You can see my belly rising to stretch your pelvic floor. Zip it up and lift. Inhale, exhale, lift. 4 more. 3, 2, and 1. See, you can hear my breath. Well done. Now with both legs up to the heavens, you can hold on to the foam roller so it won't shoot out. We're gonna do frog kicks. So with my heels and toes together, I'm slowly breathing in, pushing my belly out, knees out to stretch. Inhale and then exhale in 45-degree angle. Zip it up, breathe out. With my toes apart, heels together. Frog stretch as I breathe in. Stretch your groin, as I said, for intimacy. Inhale, exhale, and strength. Inhale, bend. Exhale, stretch. Breathe in, breathe out. 4 more. You can feel that on your quadriceps, hip adductors with your breath. Last set. Well done. Now with your legs up to the heavens, we're gonna slowly lower 1 foot down to the side. So 1 foot up, pointing to the heavens, and then exhale, slowly open to the side. And that gently stretch your hip adductors. As you inhale, exhale back, and then switch to the other side. Breathe out. Inhale, exhale as you slowly lower, zip it up, and then inhale, push your belly out as you go back center, and then exhale, switch. Breathe in, breathe out. Hold on to the foam roller. So this will help the pain, the tightness during intimacy. At the same time, lengthen and strengthen your hip adductors, the mirror of your pelvic floor. Breathe in and breathe out. 4 more. Hold on to the foam roller. Inhale, exhale. 3 more, my friends. 2 more. Inhale, exhale. Last set, my friends. Feels so good when you slowly open and lengthen. Well done. Now we're gonna do V-stretch. V-stretch is one of my favorites. As you inhale, exhale, slowly open at the same time, open your legs apart. And then once you reach down here, your dorsiflex, and breathe out. Inhale, tippy toes, and then exhale out, dorsiflex to stretch your hip adductors. At the same time, your hamstrings and your calves, and then back center. Inhale, exhale. Breathe in, breathe out. 4 more. 3. Feels so good on your hip adductors. So if you have pain during intimacy, if you feel like a burning sensation, so if you're perimenopausal and menopausal, sometimes it gets dry. That's why we need some estrogen cream that you can get from your doctor, or you can use lubricants during intimacy. Okay, my friends, now we're gonna do scissoring. Lower 1 foot down, stretch further, and this will help your intimacy because the hamstrings originates on your ischial tuberosity, and most of your pelvic floor muscles also attaches here. Inhale, exhale, switch. Breathe in, breathe out. You can use your hand also to deepen the stretch, and then you alternate stretch. Feels so good to stretch your hamstrings, and this will help your making love so you're not in a lot of pain. Inhale, exhale. Breathe in, breathe out. Inhale, exhale. 4 more. So if you have an injury on your tailbone, like you've fallen and landed on your back, on your buttocks, and you don't have butt strength, you've been sitting a lot, this can create pain during intimacy. Last one. Well done. Now let's build the butt strength. Let go of the foam roller. We're gonna do some lovely bridging, and you can use the foam roller to further enhance the strength training. So this is soft foam roller, so I could squeeze this. You can use a soft ball or a pillow. So place your hands on your side as you breathe in, breathe out, bridge. So make sure you squeeze your glutes, squeeze your stomach in, and squeeze as much as you can without overarching your spine. As you breathe in, push your belly out, slowly roll down 1 vertebrae at a time and exhale. Inhale, exhale, bridge. Squeeze as tight as you can without overarching your spine. Inhale, exhale, roll down. 4 more. 3 more, my friends. Inhale, exhale, bridge. Inhale, exhale, down. 2 more, my friends. Last one. You might feel the burn now. Well done. So those are my techniques to strengthen your gluteal muscles. But there's a progression, and if it's too challenging, my recommendation is just continue bridging. So as you inhale, exhale, lift, bridge, and then you gently march left and right. Hold that bridge, alternating, and then slowly roll down 1 vertebrae at a time. Inhale, exhale, bridge, and then march left and right. So when you isolate one leg, you can feel more instability, and you find one of your hips are weaker. So if one hip is weaker, could be the reason why you feel a pain during intimacy, and you might feel more burning pain. Sometimes the pain during intimacy feels like one-sided, and that could be your weaker side. Breathe in, breathe out, bridge. 2 more. Inhale, exhale, bridge, and march. Last one. Bridge. And now let's cool down by stretching your piriformis muscle. The piriformis is part of the pelvic floor as well. Hug your knee to your chest with figure 4. You feel a stretch here, and then switch to the other side, figure 4, and then hug your knee to your chest. And you're gonna feel that deep stretch on your piriformis muscle, and this will relieve pressure when you make love. Because sometimes when you're tight on your glutes and you're sitting a lot, You want to make sure you warm up before you make love, before sex. Last set. Alternating left and right stretch. You can hold this up to 30 seconds as you gently progress. For beginners, even a few seconds is good enough. Well done. And then butterfly stretch in lying. So if you have missionary style, this is good to stretch first like this. So you should be relaxed without lifting your head and shoulder up when you make love. That will cause contraction and pain. You want to make sure your pillows are not too high when you make love. Grab your big toes. Happy baby pose is also a good stretch. And then rock side to side. And that's it. I'm hoping you learned a lot on what to do to help strengthen and lengthen your pelvic floor muscles if you have pain during intimacy. So my recommendation is to make sure you see your pelvic floor therapist before you proceed to any exercises, to make sure you don't have a lot of complications before you start, and you make sure you have a clearance from your doctor if you have postpartum and you just had your babies 4 weeks ago. Usually, most of my patients get a clearance after 2 months after delivery. So you want to make sure you're clear. If there's some stitches done, if you have vaginal delivery or C-section. So make sure you have a clearance from your doctor before you start. If you have more time today, you can watch this video about diastasis recti that usually happens postpartum, or even women, perimenopausal, menopausal women starting having a gap. And this video about SI joint dysfunction, why you're in a lot of pain. If you need my help and guidance, you can join my Revive Pelvic Floor Health Core Rehab, where I can guide you one-on-one coaching on how to revive your pelvic floor health, or my Back Master class to eliminate back pain fast within 14 days, guaranteed. If you have suffering back pain for so many years and you don't know how to reset your spine to have a stronger back, core, and pelvic floor. So I have 2 programs where I can guide you safely and effectively. So as I said, watch this video to learn more about diastasis recti if you have a gap in your abdominal muscles due to weak core, and this video about SI joint dysfunction, which is an overstretch of ligaments and soft tissues on your pelvis due to childbearing or injury on your back. Until next time, always remember, be safe, be well, and healthy you. Bye!